Today we're going to talk about ear infections, especially in children. Children are more prone to having repeated bouts of upper respiratory tract infection. The eustachian tube is a tube that connects the nose to the middle ear. In children, this eustachian tube is shorter, more direct or level. So the flow of bacteria and infection from the nose to the ear is very easy. When a child has a cold, and for any reason, because of the stuffiness and thing, this eustachian tube gets blocked. The eustachian tube gets blocked, that stops the air entering the middle ear. When there is no air entry into the middle ear, what will happen is that there will be negative pressure. Now this negative pressure causes a change in the osmotic pressure inside, and it will cause leakage of fluid into the middle ear. This is the start how an infection will start. The first step is a fluid buildup, and then secondarily bacteria. The child may simply plainly complain of ear pain, or he may be just tugging or pulling his ear. He may have trouble sleeping, he may be fussy, he may be crying, he may even have fever, depending on the stage of the disease. So once an ENT doctor will see this child, he will examine him with his usual instruments called an otoscope, which is used to examine middle ear. And he will see the drum, and he will note any presence of infection in the drum or the middle ear. Also, to note whether there is fluid behind the drum, and to confirm the presence of fluid, we can use this instrument called the tympanometer, which measures the pressure in the middle ear. The child can be treated with decongestants and antibiotics. The decongestants can be given orally and locally through the nose. If there is infection, the child will get antibiotics. Now the antibiotics and this decongestant therapy has to be carried on for a full course as your doctor has prescribed you. But if this fluid persists and the child again has recurrent middle ear infections, the doctor may decide on a surgical course of therapy. We take a pledge. We'll treat you well.